You need to quit stopping your training anytime you get hurt. You're actually doing more harm than good. But before we talk about how much pain you should push through or why rest is so bad in the first place, I want to jump straight in and give you some actionable strategies that you can use to keep training despite having pain. The first thing you can do to easily keep training with pain is actually just change the range of motion. A good example is going from lateral raises to a single arm cable lateral raise. Another thing that you can do is you can change the weight or the set and rep scheme. Typically, you can continue to do the same movements, but if you just lower the weight and increase the reps, that should be enough to reduce the pain but allow you to keep training. Another option is performing a different variation of the same exercise with the same intended purpose. A good example of that would be transitioning from a bench press to a dumbbell bench press, or from a barbell bench press to chest flies and a tricep pushdown. Another option is to change the tempo. This kind of goes hand in hand with changing up the set and rep scheme, where you go lighter weights, higher reps, etc. You could also just go lighter weight, but go super slow motion, perhaps even adding a pause at the bottom of the rep when that muscle is in the most stretched position. Another good example is to change to an isometric version of an exercise. So instead of doing a lunge, maybe you do a lunge isometric. Now that you have some strategies to keep your training going despite having pain, the question is, how much pain should you really be pushing through? Obviously, that varies based on the condition or injury you have, but there are some good general guidelines that, if you follow, should work pretty well for most conditions. Number one, we don't want to push more than a 2 point increase on that 0 to 10 pain scale compared to your baseline before starting an exercise. So, for example, if your shoulder's hurting and it's already about a 2 out of 10 pain, it's a little sore before you get to the gym, as you're bench pressing, make sure that you're selecting a weight that does not make your pain go beyond a 4 out of 10. So that would be a 2 point increase. Guideline number two, any increase in pain during exercise should return to your baseline within about a minute of when you finish that set. So if you do go into that bench press with a 2 out of 10 pain, you do it and you have enough weight on there that it makes it hurt at 4 out of 10 pain, within a minute of you re-racking that weight, it should be back to your baseline. And then guideline number three, over those next 24 hours, you should not be any worse off than you were before you started that workout. I'm talking about your familiar symptoms, not necessarily muscle soreness or anything like that. So if you do overshoot it that first time, getting back into working out and you are worse off over those next 24 hours, don't panic. It's okay. It happens all the time. This is really a trial and error method that we're doing here. Or you're going to underdose it sometimes, you're going to overdose it other times, but there is a nice Goldilocks zone in there where we're trying to find, okay, how little can I do and still get an effect? How much can I do before it's too much for my body? The single most important factor is consistency and just not giving up when you have those pain flares. That's totally a natural part of the rehab process. If you can stay within those three general guidelines, use the modification strategies mentioned earlier, and make sure that you are progressively loading your exercises over time, most issues will resolve on their own and you will not need any professional help from a physical therapist. Now that you've learned the basis of physical therapy and how to self-treat pain, let's talk about why rest is actually so bad in the first place. Rest does more harm than good in almost every case. Our body has a built-in protective mechanism known as inhibition to shut down the muscles around an injury in order to protect you. Now, this does work pretty well if you break a bone. For instance, if you break your collarbone, you probably do want the muscles of your shoulder shut down so that you're not dislodging that fracture even further. So inhibition in that case is very useful for you to know that there's something wrong and that you need to get help to take care of that injured area. Now, unfortunately, this really works good with fractures, but does not work very well with anything else. And it can actually lead to prolonged pain with other conditions, especially something like a tendinopathy. So tennis elbow, jumper's knee, things like that. Inhibition works by your brain not sending a full 100% signal down to the muscle. And over time, that actually does make the muscles weaker. A good example of this is an ACL surgery. I'm sure someone you know, or perhaps yourself, has suffered an ACL injury, and you've seen their quad shrink a crazy amount after surgery. Well, that is inhibition taken to an extreme. Obviously, if you just have a little bit of shoulder pain, you don't have inhibition to that same level where your shoulder muscles, your deltoid, just shrinks like crazy, but you still have it going on to a certain degree, which is ultimately impacting your strength and your function. The best way to overcome inhibition is just to get that muscle firing as many times as possible. And as you do that, it will allow your brain to start sending 100% of that nerve impulse down to the muscle again to get it firing at 100% of its capacity. Now, obviously, we have to do that while respecting the pain levels and the exercise modifications that we already previously talked about. But overcoming inhibition is really the single most important reason why rest is so bad for you. Something I hear from patients often is that they are worried that if they keep training, keep working out, keep staying active or whatever, is that they will actually make their condition worse. And then if they do modify their activity, they're worried that they're not actually treating their pain, they're just kind of training around their pain and avoiding the issue. But that's not true at all. As long as you stay within those pain guidelines, there's not a single condition that you will make worse by continuing to stay active. However, the negative side effects of decreasing your physical activity will soon outweigh any potential benefits of rest. So you could say that training around pain is actually directly treating pain. Staying active will overcome that inhibition, will allow your body to develop a good healing environment for that injury, including increasing blood flow to the area, sending endorphins there to reduce the pain, improve your mental health, which also helps with injury recovery, as well as allow your body to better manage that load versus capacity issue. If you're unfamiliar with that concept, I did a video on it previously, and you can check that out in the link in the description below.